Good evening, friends, from wherever you're watching. And this is a very happy moment for entire SS team as well as for me personally to invite you to this topper interview. It's a very special topper interview because we have rank one with us here today. And not just because it's rank one, there are so many reasons as the interview unfolds, we'll be knowing all those things. This is the third year of Marrow SS. We launched the app in 2021 and we have had three exams so far, and this is the third of the exam but second of its kind because the pattern changed in 2022. And this year, as usual, we've been getting some really good ranks and really good results, but rank one is always very special. Rank one is special for the student, rank one is special for his family, rank one is special for his teachers, and that rank one tag will stay with him through his entire life. So whichever big exam that you actually secure rank one, whatever seat you take with that, it always stays with you. That means you are then rank one for your entire life. So it's on that account that we have a very, very special guest with us today. And his name is Sai. Pappu Sai is from Andhra Pradesh. He's from Telangana. Sorry, he's from Telangana, the old Andhra Pradesh, and has done his UG and PG from top colleges in Hyderabad, Osmania MBBS and Nizam MD. And alongside with him, we have Mayur Agrawal, who requires no special mention. He's our endocrine faculty. And there is a special reason why he is here because this guy, like many of the toppers now, is aspiring to become an endocrinologist. Even I had a discussion with rank three yesterday. He also wants to pursue endocrine. So there is something that is special about endocrine, I guess. So that also we will see during the course of this discussion. So anyway, welcoming you both to this show and very, very happy to have both of you and special congrats to our topper.
Thank you, sir. Thank you.
Yeah. So on behalf of the complete Marrow team, I congratulate you, and you have made us really proud. And it feels really nice that we have worked, and obviously you have worked much harder than us. I completely agree on that. But it feels, it makes us pride that yes, we are doing something. We are doing something for the students, and getting a rank one is really awesome. It's just unimaginable. I believe you would have also not thought, because nobody is
Yes.
actually sure that he will get rank one. You are
Yes.
sure that he will be selected. I agree on that. But rank one is really great, and this is the toughest exam. The last exam, at least from the point of view of degree, it's the last
Yes, sir.
exam of your life.
Yes, sir.
Yeah.
So
So
I think something really special about the course that you have done during your 3 years is that it was actually affected so badly by COVID. So I think soon after you started your course in 2020, during these 3 years of your residency, I think a large part would have been eaten up by COVID. I think the 2 years or so. It
Yes,
had
sir.
produced immense consequences on so many of the students who actually had many issues with respect to their studies and how to carry on. So you have done this course from a mass college. Nizam is a mass college where patients keep pouring in left, right, and center. And you were also affected by COVID. So, what is your personal experience? Because none of us have done a course like this. Our course was not at all of this kind. So, how did it affect your learning, and what changes did you make to your learning as a medicine person? That would be my
It,
first question.
yes, sir. It did eat up into our general ward clinic, sir, because all the wards were closed up and given for COVID exclusively, and we were cut down on our academics. Entire academics were directed towards COVID. All the journal clubs were on only based on COVID. So we had to cram up our entire Harrison syllabus in the last things, and it became hectic for us. So we
So
did
that's
lose a
what.
lot of our clinics rather than what our seniors had. At least
Yeah,
one and a
exactly.
half
So
year.
that's what I was asking. When you were planning to start up your studies, not just for entrance, I'm saying, as per a final year MD, as a final year MD student, what change does this make, and what kind of a decision you came to? What am I going to learn, and what did you actually start to learn with?
Practical stuff only, sir. Initially, the what practical stuff. I started with that stuff only, sir. Then I came to theory, and we have to do it. We had to do it practically to cover it in the entire syllabus in an extremely short period of time,
Yeah.
with very less time
So,
for revisions and re-revisions.
okay, fine. So, what did you start learning with? So, when you came to theory, like, what is your basic idea? Did you just read through the cases you were seeing in the ward, and when
Yes,
did you
sir.
start seriously learning?
Yes, sir. We started with whatever cases I saw, same topics I used to cover, sir. And at least for to be able to answer the questions which we are asked in ward rounds. Sir.
Okay.
Started with then that and then progressed to other topics to complete, or I didn't complete it, sir, but to go through the rest of the Harrison.
Okay, so you had a plan of reading the entire Harrison, or you just selected topics in Harrison and you were reading?
I started with important topics, sir. I thought if I had time, I'll see the rest of the miscellaneous topics. In the
Okay,
time I
so
had, I tried to cover, sir. I tried, but as usual, some parts were left out.
left out. So when did Marrow come into your preparation strategy? At what point did
Uh,
you think that okay, I need a help like this, and what did you start watching?
I started with the notes, sir. At the end of my mid to end of my second year, when my peripheral posting started, then they started asking specialty questions. I had to keep up with what they were teaching there. I should at least know the basics. So then I started seeing these videos and the notes, predominantly notes, the written notes part of it.
Okay, okay. So, like, which all individual subjects were you focusing at that time, or were you just watching medicine in general?
Whatever peripherals I had, I used to see that, sir. Cardio part, I tried to cover at least some part, at least 50% of it during my peripheral period. Like 1 month of cardio, I tried to cover at least 50% of cardio.
Yeah,
Okay.
so I agree. Like most of the toppers now do the same, and that is why probably the freshers are cracking better rank, because as they see cases, they learn at the same time also the theory part and the practical, and that is more meaningful, and it becomes easier to imbibe and easier to reproduce during the exam.
Yes, sir.
Exactly. Yeah. So, did you make any notes, or what was your strategy per se? Were you just watching the video casually, or you were very intensely watching, making notes, and then trying to revise that?
Actually, I don't have a habit of writing notes, sir. Can't reread them. My handwriting is bad, so I just used to watch it and rewatch it again if I had a doubt, sir. That is cumbersome, but that was my only option, sir. I can't make notes. I can't write so
Okay.
fast, sir.
Okay, that's fine. That's interesting. And my other question is like, where you decided at that point itself that you were going to be an endocrinologist, you had that idea in mind, or you keeping options open when
No,
you
sir.
started?
I had two options open, sir, both nephrology and endocrinology. Later,
Okay.
after completing my peripherals, I have just tilted towards endocrine, sir. That's it. I had both nephro and endocrine, sir. Both subjects I
Okay.
read in slightly more depth than others.
Wow, great. That's wonderful. I also know that you have scored rank 3 in INISS endocrine. You just missed by a whisker. No, there were 2 seats and you came rank 3, right?
Yes, sir.
So
Yes,
just
sir.
take us through what was different with respect to your preparation, because many students ask this question. You know, INI is on one side, NEET is on the other side. They are two different exams, and preparatory pattern is also very different. How did you simultaneously prepare for both?
For INI, that was in April, no, sir. So the first 20 days I did only Williams, sir. I didn't read actually any general medicine part. I thought what I read till now will cover off the general medicine questions which will be asked.
Okay.
So I focused only
Okay.
on specialty, sir.
So I think many of the students are finding Mayur's revision videos, actually speaking MCQ videos, very, very useful and very interesting also. So in a short period of time to cover endocrine, especially with respect to tables and data in Williams, which we find very hard to read, how much of
Yes.
use it was to you?
I did follow that only, sir. The values I used to note it down, the conversion values, especially the units which will be asked, the questions, all those I did from those videos only, sir. I used to write those points on the table, and the morning before I read those numericals, sir. Numericals I will usually see the morning before the exam, so that's it. At
Oh,
least so that I'll
okay.
retain it better. Those are all from those
Fine.
videos only, sir. The lateralization ratios and all those from the videos only I did, sir.
Oh,
Yeah,
very good.
so I
Okay, nice.
completely agree. Endocrine is totally about numbers, and just changing the unit actually changes everything. Whether you talk about ARR, prolactin, whatever you talk about, just changing the unit
Yeah.
will change everything. The conclusion, the interpretation, everything will change. Your answer would change. So it's really important. That is what we have focused on, and I have tried to make the question as practical as possible. That it's like you're seeing a patient, and also the special what I try to do is like twisting the question, just changing few words here and there so the answer changes. So that actually makes it very clear that what you should be marking. Because see, I believe because I was in the same phase, we everybody of us who is here have gone through that phase. So it's really impossible for anyone to read Williams and retain and then again just reproduce, recall everything within that short span of time. It's practically impossible.
Yes.
Yes, exactly. Now, after having finished off your INA exams, were you disappointed, to be frank, that you just missed by one rank, or you were able to study with the same venom and you were able to continue, or you were like slightly depressed that you missed
Uh,
the seat?
I didn't had the time to like ponder on it, sir, because my practical exams were just a week away after the result. Ninth was the result, and my final practical was on 16th, sir. So I
Oh,
just
very good.
left it out. I just left it
Okay,
out there, and then
left it out. After your
Yes.
pracs and after completely getting done with your MD exams, how was the preparation after that for the next 3-4 months? That's, I think, more important.
Yes, sir. I took a total break of 15 days, sir. Entire June, I took a
Yeah.
break and I started from July 1st, sir. With all the
Okay.
theory, all the notes that I just read for theory, I started rereading them, sir. Just
Yes.
to, since I had a break of 15 days, just to refresh them. And later, I
Yeah.
started doing MCQs, sir, so that I'd be
Okay.
able to cover it.
So in the last 3 months, did you watch any videos or you were strictly following notes?
Yes, sir. Videos. The updated things, sir, like the recent 2023 Kiduga updates and all those I
Yeah.
saw, sir. I thought they'd ask some questions from the recent updates.
Okay. Okay. So that's the one that you actually resorted to, all the updates with respect to the subject.
Yes, sir.
And what
Yes,
about
sir.
the question bank and test series that Marrow has also the grand test?
I used to just parallel solve, sir. When I get bored of videos or reading notes, just in 10 15 minutes, I try to solve 5 or 10 questions, leave it off, and then go back, sir.
Okay. Did
Yeah,
you
and
have
Usually, it
any
is
also
week.
targets, did you have any short targets like this week, this much has to be done? Did you keep any targets like that during these 3 months?
Yes, sir. Just some. I don't write anything on it. Just I just used to think today this things should be completed, or just I have a buffer day for it, sir. If anything goes wrong the day,
Wow. Great.
I don't have any
yeah,
written schedule or something like that, sir.
and this time what we did was an high topic videos also for this, especially this NEET SS. So did you find them some useful, or you watch the old videos only again because you were not making any notes?
Initially in the first June, the July to August, I saw my old things only, sir. Just before, like 10 20 days before the exam, I quickly went through all the high yield things, sir. All means the genetics part, those were anyway new, and the some parts like bone mineral things and all those, which are usually so much highly represented in Harrison. Difficult to turn through entire bone mineral in Harrison, sir. It will take so
Yeah.
much of time. So, that such kind of topics I did from high yield only, sir.
Yeah. Two questions which students wanted me to ask you specifically. Did you prepare biostatics or you left it completely and decided to take it up for the exam? Second, infectious disease, how did you prepare?
So biostatistics, I did prepare, sir. That 70 MCQs which were added and some more notes I have, sir, from other things also, other sources also. I had some slides, PPTs, and all those.
Yeah.
I did prepare for statistics, sir, because if any
Okay.
question goes wrong, it will be bad.
Yeah, correct. And
I-
ID?
I- Infections, just whichever questions were asked, those only, sir. Infections just maximum from MCQs. I did complete HIV, TB, syphilis, which will be usually asked for us in our theory only, sir. That I read
Okay.
more intensely from MCQ point of view. Rest, I tried, sir. Like I gave 2 or 3 days, tried to cover however much was covered and just left the rest, sir.
Okay, fine. So, like you stick to the point that giving the exam soon after your MD practice is the best time to crack the exam. There are so many people who feel that after MD you need a breathing space and then we can come strong next year. But I feel that will be like taking off the venom from you because then every year you grow old or every year you take as a second chance, then your chances of cracking the exam are coming down. What is your take on that? Should we go full on for the exam soon after the
Yes, sir.
course or then
Soon
that
after
is
the
your
course, like that is actually a personal decision, so depends on many other personal factors. So,
yeah.
but me, once a relaxation time comes, things may go haywire anytime, sir. We may not have what we have previously. So I
Okay,
just want to
wonderful.
get it off in one go, sir.
Yeah, and many of the students are also confused. Like you were totally into endocrine, so you read a super specialty book, but many are
Yes, sir.
confused. Like for especially this SS, what to read from which book. So did you refer to other super specialty books also, or just the endocrine and the Harrison?
Others also I did, sir. Some super specialty, some things
Important
uh,
topics.
important topics. Sir. For glomerulus, I have to see anyway. I read nephro, so for glomerulus, lupus, all those we have to have some. And like they will ask
Yeah,
questions now. So for common topics, I did super specialty books also. Sir. Some
yeah,
parts.
some parts, correct. And I think as far as the major core areas are concerned, like nephro, rheumat, endocrine, liver, all these things where they ask a lot of questions, I think we have also tried to cater to almost everything in the super specialty book. I think Mayur has discussed every nook and corner of Williams. I don't think you even Williams may have forgotten many things written in that. So I think that way we have gone into every nook and corner. Like me personally, also like tried to go to everywhere in and around Pihali because Pihali is our textbook. So like that, I think every faculty has tried to do that. my question for you is, how useful is our thing for final final MD theory? So for final MD theory, can we
Theory
actually
also,
consider
I
this?
did the same thing, sir. Theory also, I did super specialty, but I did more of notes, sir, because time wasn't there to watch all the videos.
Time?
Notes,
Yeah,
notes, notes, because I don't have the habit of writing notes.
yeah.
Those same
Notes.
notes for theory, same notes for NEET SS also, sir.
Wow, that's wonderful. That's great. Okay. So, what about your choice? I mean, you have actually told us that you want to join in Usmani itself. You missed
Yes, sir.
INI by one rank, but you are not very keen on going for INI or Central Institutes. You are very keen on happy on studying. I mean, studying Usmani and studying in Usmani itself. So, what makes you choose that way? Is it your personal choice, or is there any particular reason?
Personal choice, sir. I saw, like, we went for peripherals to Usmani only, sir. I found it
Okay.
useful. The teaching was very good. In the brief stint of 15 days we had there, only 15 days. So I thought it is
Yeah.
better to go on with it. I thought either AIMS PG or this one. Anyway, I couldn't get it. This time there are no seats. So I wanted to continue.
Okay, fine. Yes, wonderful. And any particular reason for like choosing endocrine, like intervention related reasons or anything with respect to you find something special about endocrine? Is it that it, what do you say, triggers your brain the max, or any particular reason for liking endocrine so much?
Single clinical scenario with many differential diagnoses, sir. We have to think broadly and then try and narrow down with one clue provided. And we have to
That's
search for the clues. So
So,
okay. That's fine.
I think that's the best answer. And now, even if you see, like most of the toppers are going for endocrinology only.
Yes.
So it's
Yes.
more type refined medicine, I would say. Further
Yes.
upgrade, rheumatology and endocrinology are further upgrade, I would say, to medicine. So
Yes.
you still remain in that medicine portal
Yeah.
because that is what you opted for initially also. And it's a better version of yourself.
Exactly. That's
yes,
what
sir.
I was telling everyone who was thinking about nephrology, that nephrology is a totally different science. It has no connection with medicine. If you want to actually stick on to medicine, then you please do endocrine or rheumatology, because nephrology is now become pakka intervention. We are more into more of intervention, transplant, newer forms of dialysis modalities, etc., etc. It has actually got no colors of the original medicine, maybe 10% of that. But as he said, endocrine and rheumatology will make you a better version of the medicine person in you. So you can always use the medicine also. And I think as in practice, I think Mayur will be using a lot of the medicine as well as endocrine. So it's like a combined practice. But if you sit and do nephrology practice, it is not going to have anything with respect to medicine in that. So it will be a totally different practice. So that's always correct.
Yeah, because initially it was like in India, if you don't know tuberculosis and malaria, you cannot practice. Today, if
It's
you don't
correct.
know diabetes, you cannot practice.
You cannot practice. Correct. So that's perfectly right. Now, what is your bit of advice for people who are entering into first year of PG? This is a big question we are actually facing. Many students of Marrow who have actually cracked NEET PG entrance, going into PGs, getting the NEET SS app, and seeing a lot of videos from a lot of faculties. So much of content. How will you ask them to structure their course now that there is no COVID and they're getting more space? Just give your plan. If you're starting again, how will you structure the course? When will you start reading, and what will you read?
Sir, plans are kind of personal, sir. If one is capable of writing notes, I'd tell them to write their notes and revise, because that will be easy rather than sifting through all the pages of Harrison. That will be cumbersome. But I'd start with what cases I'd seen what, sir. That is my only starting point
Yeah,
always.
correct. Correct. Yes. And is it like when you watch a video after reading Harrison, you get more yield, or after watching a video, you can just go through Harrison to see whether it is in perfect sync? Which is the method that you find is more useful?
I tried both, sir.
Mhm.
Actually, I didn't find a difference, but I tried both, sir. For some topics, I found seeing the video is better, which are
Seeing the video.
some concepts which
Because
are not explained in Harrison.
I personally have a feeling, especially with respect to endocrine, that Mayur's videos are more updated and more, I think, more refined with respect to endocrine than Harrison is. So
Harrison, I
when you
use. Yes, sir.
yeah, so Harrison may be like maybe saying something that is say 2 years or 3 years old. Here we may be discussing something that is 3 months or 4 months old. So in that context, always it's important for the student to know what is most latest and what is most updated. So I
Yes.
think that's the same thing. And what about your like emergencies and all? Did you read something, or you just seeing whatever cases that came to your college with
Uh,
respect to the emergencies?
Emergencies, the critical care part given in Harrison, sir. I didn't go beyond it. Just the critical care part of Harrison. That's it. And
That's it.
cases anyway we'll see. No, sir. That's it. The same, sir.
Yes.
Nothing. I didn't go beyond it.
Didn't go beyond that. Okay, great. So
And
yes, so I
did
think
you
you
feel
have
that
crystal clear clarity. Yeah.
Sure.
And go on. Did you feel that this previous year paper solving all those videos were really helpful? What did you feel that that helped you to gain confidence, and also some of the repeats were there?
I saw only only the last year papers. I didn't go so back previously. But for INAs, though, there were some repeated questions. That was more useful for INA.
Okay, fine.
Because the pattern has changed, no, sir. I just saw the last year's paper. I sifted through the last year paper, but this time it was slightly different. I guess sir. Genetics was underrepresented. Last time it was multiple questions were there.
Yeah, correct. What about the interview? Just like discuss to us regarding your interview at INI. How was that experience? Like, what was the general experience? What did you feel before, and what happened afterwards?
I was told that I'd be asked about my thesis and all, sir. None of it is related to endocrine because I did a thesis on pancytopenia. But
Okay.
they asked pure endocrine questions are all kind of difficult questions only, sir. Pseudo hypercalcemia they've asked me, sir. I was unable to answer. I particularly remember that one. Endocrine effects of multiple myeloma. All the endocrine, not the basic ones. All the endocrine effects of multiple myeloma they've asked. All the mechanisms of action of lithium with the molecular mechanisms. Not just what the effects, but with the molecular mechanism which is responsible for the effect. I thought I would have read better, sir. I would have done better if I had read something more.
Okay. So real high funda questions, no?
Yes, sir.
So,
All difficult questions, sir. All 6 faculty asked and everybody asked a bit of difficult questions only, sir.
okay. So the fact that you got rank 3 means the others have actually not answered as good as you. So there are only 2 people who have answered
Sure,
more than
sir.
you. So it's the others have not answered. So that's fine. That's very normal. So that's great. And finally, like, what is your advice? It's a general, very cliche question, but somebody who is preparing, maybe not getting this time, has got 1 full year with him. Should he work and prepare, or should he just work now normally and then prepare later on only? How much time does somebody need for this exam? Serious preparation, how much time if somebody needs?
I thought 6 months, sir, because till we were relieved of our ward duty since the past 6 months, sir. That's it. Till then we had our wards. And
So
even
six
in the
months
last
solid,
two even in the
solid
last 2 months we
preparation.
did our SR ships, sir, so I can't include those also. Pure
Okay, okay,
holidays we
okay.
did not have any time, sir. We used to go to our ward work, read in the evening time which were possible.
Okay, fine.
So I thought 6 months might do it, sir, if we were staying dedicatedly, like at the same place without any other things.
Fine.
So I think, Dr. Rakesh, everybody has their own pace and everybody has their own time utilization way.
Correct.
Somebody may think that it's better to sit and read. Somebody will think that it's
Yeah,
better to read along with CE patients so that you retain more. And somebody may
correct.
think that making a notes is better, whereas somebody may think that it's better to watch the video and then go on to the books. So I think everybody should make their own way to the success.
Yes,
Yes.
exactly. Now, why we ask all these questions is see, most of the questions that I have asked you are the questions which students actually want to know from the toppers. So it's exactly the same questions that we are relaying forward. But as you rightly pointed out, and Mayur also said, like, these are personal, very, very personal. The reason why you choose endocrine may be a pure personal reason which may not apply to somebody else. So that's why answers are personal, but the questions are very generalized questions. So that is how these questions and answers are. And
And
again, my point, which some of the students actually wanted to ask me, is with respect to the second year, that you have during your PG course, where you're posted in different specialties. So at that point in time, should somebody have a very, very what do you say, clear idea that during this much time to be read finishing this much? Do you have a plan like that? By the
No,
time I
sir.
end up in course, no, you didn't have a plan that way.
No, sir.
That I
No.
have
I
to
just
finish. No, no,
no, sir. No.
no.
That
So I
kind of
think that is
goalpost I didn't put at that time, sir. At that time I didn't
yeah,
put.
yeah.
yeah,
So
so
that's the same thing with
many
correct.
of the aspirants would be slightly relieved with this, that yes, you can get rank 1.
So that depends on many factors, sir, like multiple
Yeah, correct.
factors, no, sir.
Yes, agree. Uh, and yes, and one question from my side: any
Sure.
feedback for us also, so that
Yeah.
makes us further improvement on the app, and it will help further endos or further aspirants, all those who are
Uh,
applying for exams.
so no, from my side, it might be a personal thing only, sir. I want notes, sir, for all the recently uploaded videos, so it will be easy for me. For somebody like me who
Yeah.
doesn't make notes, it will be easy at least to
Correct.
revise.
Yes. So we're strongly
And
considering that we have so much of issue. I mean, so much of queries with respect to notes, and so much of I mean, across the country, people asking us to give notes. So obviously that will be considered, because I was thinking like for a super specialty kind of an app, again releasing these books, because if you start giving notes, I think it will come to almost 25 books or 24 books at least minimum, because cardiology itself will come to 5 6 books, endocrine 3 4 books, nephrology 5 books. So I think we'll come to more. The neurology maybe some 10 books or something. So that's the reason why we did differ with respect to notes, right? To be like huge content, huge content. So maybe we'll definitely consider. 100% we will consider. So
yes, sir.
again, wonderful interacting with you. I think you're very crystal clear with respect. That's the reason why you got ranked. But I think more than the knowledge you have, it is because you are so clear. You have no hesitation with respect to any question. You are like very clear with respect to what you want. Even in your choices, I think you're very clear with respect to what you want. That's something which everybody can actually. That is the major take home from today's interview. That means
Sir,
have clarity with
I
respect to thoughts.
I don't like it might be clarity for me, sir. I just told what I did, sir. That's it. It might not work out for someone else, no, sir. What I did, I just have told you, sir. That's
Now
it.
that is the aim of this interview, no, to know
Yes,
what
sir.
you did. Because we haven't discussed what we have done. I have my own strategy. Mayur would have had
Yes, sir.
his own strategy. That doesn't apply to anybody else. But what people are looking for, the large number of students who are watching this want to hear your strategy. And your strategy is as simple as it can be. It is the most simplest strategy. Sit and study, you will get the entrance and don't have any confusion. So that is the most simplest strategy. And I'm very happy that you have not said any complex things. I think you have not gone to any complexity. You just said that you watch, I mean, see patients in the ward, come and read that. After the exam is done, you read whatever possible, and you can't make notes, you don't make notes, because there is so much of fuss around notes these days. That means people are like so crazy on making notes. They use 10 colors and make notes, correct? So in that era, you are coming and saying that I don't want to make notes. Means yes, that is your
Never
plan. That's
did, sir.
perfect.
Never
Yes,
did,
that's
sir.
perfect.
Not even for PG, sir. Not even for PG. I did not make any notes. I just used to read printed books or given notes or some printed material. That's it. I never made notes.
That's wonderful. So that's
Yeah,
great.
really, the answers were really simple and sweet to the point, and
To the
actually,
point.
yeah, it will bring some hope to those who are following this, because
Exactly.
most
Yeah,
of
that's what I was also thinking. Your answers are like how you should even be even answering for an exam. Not too much of answering, not be going around beating around the bush, nothing. You're just to the point, right to the point. So that's wonderful. So I think really great, and once again special congratulations to you,
Thank
and
you, sir.
special thanks for Mayur also for joining us. And this was great interacting with you, and hopefully we'll get toppers every year. So rank one is always special for all the faculties and everybody involved with this Marrow SS. So hopefully we can keep getting these first ranks every year, year after year. So once again, thank you so much.
Thank you, sir.
yeah.
Thank you, sir.
Thank you and congrats again. You are the one who makes us keep us going.
Yes. Thank you, sir. Thank you.
Okay, bye bye.
Yes. Bye, sir.